With that conversation. Now, as we wrap up the 10th of October here in Morning at NTV, we do have a poignant conversation that we cannot leave without having. And this is a health-related conversation looking at cervical cancer. Yes, it is one that is prevalent, especially when you look at Uganda having the 7th highest incidence rate of cervical cancer. And in East Africa, you know, our performance is neither good. So we're looking at a rate of 28.8 cases per 100,000 people per year that have to deal with this gruesome condition. But with the partnership here at NMG, we're able to do some work and interactions and engagements with UMC Victoria Hospital. And with me, I do have Dr. Ramin that is joining me for this conversation, as well as Caroline, all from that angle. And they are here to help us understand cervical cancer, but also what are the solutions around it, because this is not a disease that is so common and yet so common. And by so common, I mean that by the time we get to find out that someone has cervical cancer, it's in the final stages where not much treatment can help, and the next alternative is for them to die. But anyway, doctor, you're a gynecologist, and we would like to understand this condition better. What is cervical cancer, and what would be the early symptoms that I would have to look out for?
Thank you so much, Priscilla. Well, cervical cancer is a cancer that affects the cervix. The cervix is the gateway into the uterus. And cancer, by virtue, is a mass of cells that lose control and grow abnormally and have the potential to invade. So cervical cancer, in short, is a cancer involving the cervix. It affects women primarily in their reproductive years, because it's one of those sexually transmitted cancers. The main cause of cervical cancer is an infection by HPV, which is a virus. The majority of us are exposed to it during the course of our reproductive years. Many clear the virus, but a few retain it. And this chronic infection in the cervix by the virus allows some of the cells to grow in an abnormal way, and they result into cancer transformation. Okay.
All right. So you have talked about the HPV virus. How does one get to know that they actually have this virus and then be able to adopt the preceding treatments?
Okay. Now, the HPV infection is usually transient. It comes and goes in most people. But testing for it is done. There is a DNA test. A swab is taken from the cervix and sent for molecular laboratory analysis. And you're able to see if the virus is available, is present or not, through that test.
All right. Yeah. And then thereafter, you're able to determine if it's going to be cancerous or?
Yes. Now, testing for HPV is one of the ways of screening for cervical cancer. But the one that is more commonly available is for looking at the effects of HPV on the wall of the cervix. So HPV causes changes, the cells change shape, they change appearance, and that is the one we commonly detect.
All right, so we're talking about a body part on a woman's body that is not, you know, you don't see it on your face. You don't see it on your skin. So by the time someone senses there's something really truly irritating around them, it may be, you know, as women, we'll tend to think, no, it's something small. So what are those early symptoms or signs that can indicate that I need to go for a checkup?
Yes, you're absolutely right, Priscilla. It's not an exposed part, so it's easy to miss. Unfortunately, the early symptoms are quite mild. They don't draw a lot of attention. Usually you have bleeding, which every lady has. It doesn't raise any red flags. There is usually an abnormal discharge. Many people keep on treating it for recurrent infection. Then you may have some later symptoms. If the cancer invades the surrounding structures, the bladder in front, the rectum behind, you may see blood in the urine, you may see blood in the stool. Yeah, but like you rightly said, the early stages don't produce much symptoms, and that's why screening is very important. Okay. Because the earlier the earlier you're able to detect the cancer, the earlier you can start the treatment, and it's one of those cancers that has a good cure rate if it's detected early.
Okay, so how does the pap smear work?
Now, the pap smear is actually quite simple. You come to the hospital, you are positioned comfortably on a bed, then a speculum is inserted to look at the cervix. It doesn't pain, and a sample of the lining of the cervix is collected and put on a slide. Now this slide is taken to the lab for analysis, and they look at the features that would suggest malignant transformation. So with cervical cancer, there are changes that are pre-malignant, like before the actual cancer develops, and then there are changes that are malignant. Okay. So we can detect a cancer in the cervix actually before it has fully converted into a cancer.
Okay, all right. Caroline, you are one that has had a chance to go for screening, the pap smear screening in particular. Could you walk us through your experience?
Wow. Sorry. There has always been a stigma around it. When you hear about evasion, you're thinking, oh, I'm going to open my legs, it's going to be uncomfortable. And it wasn't comfortable. I can't say it wasn't comfortable. It wasn't very, very uncomfortable. However, the lady was gentle. The one that examined me was a little bit gentle. She told me, it's okay, you can relax. She did her thing. She picked the sample. It doesn't take long. It took about 5 minutes, I could say, and it was done. However, it's a little bit, it's not your usual testing that you would say, okay, let me just walk in and do a routine checkup. No, it's not something that you just go and do. You really, really must want to do it. Yeah, so I would encourage people to actually go ahead and do it.
All right. Now, in as much as, of course, there's stigma, because there's quite a number of ladies who choose not to go for these screenings, especially cancer-related, not for the disease in particular, but for the procedures that they have to go through in order to get to find out what truly is in their bodies. However, negating that fact, we still have to look at the hope that there's preventative measures in case you are found with the HPV virus, or you actually are having some stages of cancer, cervical cancer to be exact. Talk to us about those preventative measures.
Thank you, Priscilla. So with cervical cancer, it's one of those good stories we can tell. There is actually good ways of preventing it. For young girls, school-going age, who have not been exposed to it, there is a vaccine available, HPV. It covers about 9 common strains of HPV that cause 75% of the cancers. So our young girls, when they get the vaccine, their chances of getting the infection in the future, and therefore the cancer, is dramatically reduced. For people who have not had the vaccine, there is screening every 3 years. All ladies within the age group 20 to 65, we advocate for 3-yearly screening. The pap smear that Caro has talked about, it is not the most comfortable test you will have, but it's not really painful, and it's very effective in detecting the cancer before it becomes advanced. Yes.
Okay. All right. So let's talk about the partnership that you're having with Nation Media Group. What is the purpose, and what are you intending to address with this partnership?
Now, with this partnership, we want to look at promoting women's health. We want to make sure that women are empowered to detect some of these health conditions before they adversely affect their lives. The common cancers, the cervical cancer, breast cancer screening, and then of course STDs. STDs are a big blight on the society as a whole. Many times they are misdiagnosed, mistreated as urinary tract infections, and this negatively impacts the health of our ladies. So we want to make sure that in October is a pink October, we prioritize our women's health.
Okay. Well, usually that comes with encouraging women to go for screenings. Are you offering some screening services at UMC?
Absolutely, absolutely. We have the initial screening at UMC this month. We do the VIA. That is a quick screening way. And then also we have the more elaborate pap smear. Then we are also doing breast cancer screening throughout this month, free of charge. Okay.
All right. Thank you so much, Dr. Ramin, for your contribution to ensuring that this disease is dealt with in Uganda. And Caroline, I know that it took a lot to share your story, but thank you so much, because it's encouraging to let the women know out there that in the midst of a discomfort of about 5 to 10 minutes, you are actually saving your life. So go for a screening for cervical cancer and breast cancer. It is the pink month, And we here at Nation Media Group, we're going to also be drawing a lot of attention to that. Our partners, UMC Victoria Hospital on Bokoto Street, you can be able to go for those screenings at a discounted price. But overall, it's also our customer service week, and here on Morning at NTV, we want to say a big thank you so much to each one of you that again choose NTV Uganda to turn on your world. You have worked with us in different capacities, in different sectors. We want to say thank you so much. Mweba Lenyo, asante sana. For that, have a good day.